My name is Joshua Gilliam. I'm CEO of Armur Medical. I'm here with my good friend and provider, Dr. Domm. We're just going to have a conversation today about hormones. You know, Doc, it's been 3.5 years since you and I started together. I can't believe it. Time flies. I remember just, it seems like yesterday that we recorded our first set of videos. Sweating on the camera, unpolished, kind of the unwashed of the world. But now, we have had the opportunity to do thousands of labs over the last 3 years. We have looked into the world and looked into the population of aging men, 35, 45, 55 and beyond, myself included. I remember where I began with you at 270 pounds, really weak, did not have the muscle mass, did not have the desire to work out, coming home exhausted, just falling out at 4 PM, watching TV, falling asleep, going into the bed at 9 o'clock, getting up tired the next day, starting that vicious cycle. But when I started hormones with you, all that changed, and it's changed my whole perspective: mental, physical, emotional, spiritual. And I wanted you to speak into the importance of those initial labs.
It's, you can't do anything until we know where we're at. If you don't know where you're at, it's hard to know where you're going to go. And so with initial labs, we just do a basic panel, I think 14, 15 labs that talk about where you're at from a hematological perspective. That's a big word, but it's just basically a CBC, a CMP. We get your total and free testosterone. We get your PSA, or your prostate specific antigen. We get your lipid levels. We get your hemoglobin A1C. As guys get older, there's a tendency to start getting closer towards type 2 diabetes, given the standard American diet, which is called the SAD diet. And so we get a number of the labs. We get your estrogen level. We get your CMP, which is your complete metabolic panel. We get your thyroid panel, a full thyroid panel of your TSH, your free T3, free T4. So we get a number of labs that most doctors don't pull when they're talking about hormone levels. We also get your DHEA. We get your vitamin D level. And so those are important when we get an initial set of labs. They tell us where you're at. So many times people are deficient in testosterone. They may be close, they may be low, but they've got symptoms. And so we look at everything, we assess everything, and then we move forward.
Very good. One of the things that I like about what we do that I see is very different through, I may even venture to say thousands of conversations in the marketplace. We have colleagues in the marketplace. We know the competition around us in hormone replacement therapy. Is I see a lot of ads even in my feed because the algorithm knows me. They know what I like. So it shows me things. And I see all the time, testosterone replacement therapy, $89 a month. Testosterone replacement therapy, $100 a month. And we look at that and it makes me chuckle because what they're doing is they're just dangling a carrot. They're giving this one-sided fix to hormones, but that's very different than what we do because we're not just a testosterone clinic. I think about my protocol, and you can speak to this for the average man. Testosterone, vitamin D levels were low, DHEA levels were low. You've educated me on the importance of those three being optimized together, coming in and layering on a really good quality protein. Creatine nitric oxide was a game changer for me, switching from a pre-workout. Just in a few words, tell the difference between Armur Hormone Clinic, Armur Medical Hormone Clinic, and just the testosterone clinic that's trying to get your nickels and dimes.
Well, there's a big difference, and that is, let's say you go take your vehicle in, your truck in, your car in, and all they do is change your oil. They change your oil, but they don't do anything with the transmission fluid. They don't do anything with the brake fluid. They don't do anything with the wheels filling up the air in your tires. They don't do anything with your windshield washer fluid. All they do is change your oil. Let's just say you go to a symphony and you sit down, you dress to the nines, you go in, and all you hear are flutes playing. And you're like, hold it, where's the percussion? Where's the strings? Where's the drums? Where's the horns? Where is the trumpet? And so a symphony has a combination of everything working together, as does your engine when you take your car in. And so we don't just do the testosterone. You are so much more than just testosterone. You have thyroid hormone, you have human growth hormone, you have nitric oxide going around in your vessels, you have testosterone, you have DHEA, you have vitamin D, you have a number of things that all need to be balanced. You can't just look at one thing and think, wow, wasn't that symphony great? Those flutes were great. It's more than that. It's about the total symphony of hormones that you've got going around in your body. And when you balance them and when you optimize them, I'm telling you, guys feel 100% better. Their mood, their motivation, if they have any depression, many times depression leaves them. If they have anxiety, if they have levels of testosterone where their energy is low, whether their libido is low, a number of different things. Not only that, but we work with people to help decrease heart attacks, decrease strokes, decrease Alzheimer's disease, decrease and help prevent prostate cancer. It's a number of different areas that people are going to feel better when we balance not just the testosterone, but most all of their hormones.
Yeah, thank you. Another thing that I just want to kind of circle the pool and dip my foot in, it's really a big conversation for maybe a short video like this, but we're hearing about peptides so much in the market today. And that kind of is a little bit concerning to me because so many guys are talking to me about what the protocols are, what they can do. And then they're mentioning these gray market, we'll call them gray market research peptides that they're taking.
Right.
What's the importance of getting away from those, even though they may be a lower cost, to getting to a legitimate peptide that meets a legitimate goal in your life?
Right.
Let's just talk about maybe that in reference to like lean muscle mass.
Well, the number one thing is there's always going to be something new. There's going to be a new flair. There's going to have a new, have you tried this? Have you tried that? Oh, I tried that last year. I need to try this year. And when we look at peptides as a whole, we need to keep a couple of things in mind. And that is, for the most part, many of the peptides, really what they're working on or what they affect is help to cut weight, help with lean body mass, help with tissue repair, help with energy, help with mitochondrial energy and boosting of your energy in that respect. And there's a lot of times where people will buy these online, they'll get them from India, from China, and really that's gotten so popular that there are companies out now that sell different tests that will test the purity of these peptides and these additional hormones that you can buy from these online places. The tests are typically expensive, but just the fact that we've got them tells us we need to be careful when we use them. And so come on in. We offer a certain number of peptides. There's a number of peptides that are not FDA approved, and we really can't prescribe non-FDA approved peptides. We do the ones that are safe, that are effective, that we see benefits to, and those are the ones that most people should do.
Sure. And you know, and stacking that, my experience, because you've been guiding my health now for 3 years, starting at 270 pounds and then leaning down to 212 and then building back on lean muscle. This morning I was 233. My experience has been, and the majority of that has just been through hormone replacement care.
Yeah.
Like my protocol that I outlined, testosterone, vitamin D, DHEA, creatine, protein, nitric. That by itself, I mean, you know, the proof of the pudding is in the tasting.
Right.
I mean, we've seen my measurements go down, and then my lean muscle increase over while my body fat is decreasing. I would like to challenge the person that's listening today. Don't get caught up in the hype. Come see a medical professional. Get with someone who does this as a specialty. And I really want to land there for 2 seconds, because we get a lot of guys transitioning into our practice from primary cares, urology, other people who do testosterone, but they're not a specialist. And I like to say that even though they're great in their areas, cardiologist, best cardiologist, urologist, best urologist, primary care, wonderful at diabetes, blood pressure, etc. But when it comes to hormones, I don't want to downplay anyone, but the average.
Well, I can.
Yeah. Go ahead.
So going through medical school, they don't teach you much about hormones. Going into residency, and I'm board certified in family medicine, I learned nothing in family medicine about hormones, how to treat hormones. Now, there's a couple things that are important. Number one, we've learned in many areas in life, the foundational basics are the best. You want to raise a kid, you want to feed them good with good nutrition, that's a foundation. Give them protein, give them carbs, give them, it's the whole meat, protein, and vegetables type of thing. Dessert, fine, every once in a while. The same thing is true with hormones. There's a basic premise of the hormones that you need to balance. Get those in line first. And then after that, if you have areas where you need improvement in, then we can look at some of these other desserts or peptides or nitric oxide or some of these other things. The nice thing about what I've done is I started a family medicine clinic mainly because I was referring my patients who were on hormones back to their primary care doctor when they had high blood pressure or some other problem. And what happened was many of their primary care providers had never been educated in hormones. They didn't know anything about hormones. And so what they did was, oh my gosh, you're on testosterone, it's going to explode your heart. I've heard that a number of times. And so I started a family medicine practice to help treat all the patients that were coming in saying, hey, can you treat my high blood pressure? Can you treat my cholesterol? And so what we've got is a family medicine clinic that's separate, that's independent of Armur Medical to provide care for these people that understand hormones as well. But yet at the same time, they understand the disease process of whatever comes in. And so that's the fact. The basic fact is most primary care doctors, as well as other groups, they don't know much about hormones. They know we should stay away from it. There was a women's health initiative that came out years ago that said women's hormones causes cancer and heart attacks. And so from that, everybody shied away from it. And what we use is bioidentical hormones for both men and women. And they're anti-inflammatory. They don't cause cancer. They don't cause heart attacks. To the point where the Mayo Clinic had a speaker at their conference last year that said every man over 45, there's no reason why they shouldn't be on testosterone.
That's good. Without getting into a conversation that my children's friends will hear on this video and embarrass them, let's talk a minute about what this means for guys who are coming into their 50s and 60s, still in love with their wives, still wanting to be sexually active, but now they're having a decrease in regularity of erections, strength of erections.
Right.
How does this all work together? Because so many times they just go to their doctor and get the little blue pill, or they'll take something. But isn't that like putting a Band-Aid on it?
Well, it's exactly it, putting a Band-Aid on. I think I've told you that many, many times. And the fact is, when some guy, 45, they start noticing some changes in their body. And that's normal. And I've sat in rooms with many different men telling them when they don't really want to fess up or be honest with me or be honest with themselves, where they say, oh yeah, everything's great. My libido is as strong as what it was when I was 20. And I look at them and say, listen, you're 55. That's not the case. And 90% of the guys that come in have the same exact problems you do. And at that point, they kind of, bring the tone down a little bit more to a serious level. And what I've seen is that most guys in their late 40s, their 50s, they start thinking about different things. They're not thinking about the wild weekend they're going to have with their wife or their girlfriend. They're starting to think about their family, their wives, how they can live longer and stronger into their 80s and 90s. And whether their moods have decreased, they maybe have a little bit of melancholy, a little bit of depression, they have a little bit of anxiety. They're looking at retirement thinking, man, I don't know if I have enough money. All of these things come into play. And all of a sudden, one night when they're trying to be intimate with their partner, all of a sudden things may not work like they used to work in their 20s and 30s. And I tell them that's normal. That happens as you age. Now, what we need to look at, especially when some guy comes in and says, hey, doc, can I get that little blue pill or that little yellow pill? Not a problem doing that. I certainly have prescribed them. I don't have a problem with it. My views have changed now. And now what I do is say, absolutely, we can get you that pill. But you know what? Let's get your levels tested of your testosterone and some of your other hormones first, because that's the root of the problem. And many times guys will show that they've got either low testosterone or normal but lower levels of testosterone. And so with that, we have a discussion and we talk about what does that mean. Men lose 1 to 3% of their testosterone level and production every year after age 30. So if you have a guy who's 50, that's 20 years. So they're down anywhere between 20 and 60% of what their levels used to be. And so it's important to let them know that, because guys don't want to be awkward and not normal, and they don't want to admit failure or a decrease in their level of productivity. And so we talk about it and we get their levels tested. But I'm telling you, most men, when they get their testosterone levels optimized, it's like the clouds disappear, the sun is shining, and they're skipping on down the road because they're feeling so much better. Their moods are different. And then if their wives come in with them, their wives, many times the men will be like, I don't notice much. But their wives who see them every day, they're like, this man has changed.
Yeah.
And so it's important to really get to the root of the problem and just say, this is normal. Yeah. Now let's deal with it and move on.
We spent, a lot of time talking about pre-workout, nitric oxide, arginine, citrulline. I remember it in the very first few years. Yeah. We were really trying to find that magic bullet to really offset the loss of nitric oxide in the system. Right. And I believe we found the product for that. We've had such good results on it. But just briefly, not talking about the product, but tell us about nitric oxide, the difference between a 14-year-old and a 40-year-old.
So there's a huge difference. When you're 14 years old, everything is new. You're a newer model. You don't have the plaque buildup in your arteries that a 40-year-old or a 50-year-old has. And with that, so when you're 14 years old, you don't have the buildup of plaque in your arteries, the wear and tear that a 40 or 50-year-old man does. And what happens is by the time you are 50 years old, you have about 70 to 80% less nitric oxide effect in your body. And that's primarily because you've got plaque buildup covering where the nitric oxide is released in your blood vessels. And so that's why it's important to really hone in on the fact that nitric oxide is vital for an older man, especially if you have a history of family members with cardiovascular disease, high blood pressure, any kind of vascular disease, any type of symptoms that resemble any of those, strokes, heart attack, diabetes, any of those, you really need to supplement your nitric oxide.
Very good. And just a summary of that, am I understanding you right that the better the nitric oxide in your system, the better the blood flow?
Right.
And that's why we're seeing the advertisements on TV, beet juice, etc., that's out
Right.
there, and they're targeting erectile dysfunction. But in our instance, the way we're replacing it, we're targeting the cardiovascular system.
We do both.
Yeah. So talk about that for a minute.
We do both because we have to understand what nitric oxide does. Nitric oxide is released into the bloodstream. It helps your blood vessels vasodilate and constrict. And as a person gets older, their blood vessels and their vascular system becomes much more rigid. It's harder to contract, harder to vasodilate. And so what nitric oxide does is it kind of helps you along with that. And not just in your cardiovascular system, in the heart vessels, but all over your body. Yes, erections are helped with that as well, but also in your lungs, in your legs, throughout your body. And if you work out by taking a nitric oxide supplement, what it's doing is vasodilating the vascular system to get more blood and blood flow to your muscles. So when you do work out, you're getting more blood flow, more of the growth factors and everything else that goes into when you're building muscle. So that's important. It's not just it's more of a multifactorial benefit to cardiovascular health.
Yeah. I like what you're bringing into play there about the workouts and building muscle. A lot of times when I talk to guys and I tell them I'm on hormone replacement therapy and the results, they say, well, that's because you're at the gym every day, but that's really not the case.
No.
I work out 3 days, sometimes 4 days a week, and I have active recovery days also. Why is it that guys can take testosterone and begin to, even if they're not working out, begin to see a decrease in body fat and an increase in lean muscle? What's the deal there?
So the main reason is, like I said, at age 30, you start losing your testosterone. Testosterone's it's an anabolic steroid. It's going to help build muscle. It's going to help build endurance. And when you start putting back what nature took away, you start going back in years in terms of your muscle strength, your muscle mass, and that's important. Recent studies have come out and they've showed that one of the number one factors or criteria for longevity is your muscle mass and your muscle strength. And they did another study with twins, and they showed that your lower extremity muscle mass has a positive association with cognition. And so the more you exercise your lower extremities, the better your overall health and the overall cognition that you're going to experience. So it just stands to reason that when you replace something that's missing, you bring yourself to that level playing field again, where you're stronger, you're faster, you've got more endurance, and overall, you're going to be healthier. And you're going to be able to weather the storms that come your way down the road.
Wonderful. I want to ask another question. We've talked a lot about, over the last 3 years, we've talked a lot about different delivery methods of testosterone. And I've always kind of drawn this analogy. There's the Lamborghini, there's the Mustang and 5.0, and then there's the Volkswagen. When you're looking at what's available and how to take testosterone, what's the best, what's better, and what's maybe not even recommended?
Right. So there's a number of different styles of testosterone you can take. We primarily use the injection or the cream. I use those two for main reasons. With the injection, you can kind of dictate how many times a week you're going to take it, so you can keep your levels up nice and level. It's fast, it goes into the muscle, it works quickly, and it stays in your system.
Does it hurt?
It really doesn't hurt that
That's
much.
the main question we always get.
I know. Some people, they'll hit a nerve and it'll hurt a little bit. But I'm not going to lie, it does sting at times. Other times you can give yourself an injection either in the thigh or in the buttocks, and you can't even feel it. There's also a cream, both for men and women. This is different than the gel that is commercially available. We use a bioidentical hormone or bioidentical testosterone. For women, they put it on their labia and clitoral hood. For men, they put it on their scrotum. The reason that you put it there is because it's much more, it affects your testosterone levels quicker and faster. And it is absorbed much quicker there rather than on your leg or on your arm, upper arm, where typically they use it in the past. There's also pellets that are widely popular. It really comes down to what the patient wants. The pellets I don't necessarily like as much because they're much more expensive. What I've seen with patients when they come and talk to me about that they've had pellets in the past, they'll get the levels up really high and then they drop, and after 2 or 3 months, now they're not feeling it anymore. Their moods return where it's not a real happy mood. Their anxiety has returned, and they've still got 2 months left on their pellets. And so what you end up doing is then supplementing it with injections or cream. And from my perspective, it's just easier to go with the shots 2 or 3 times a week or the cream once in the morning and once at night.
Yeah, very good. Listen, there's a lot that we could talk about. Nobody loves hormones more than Dr. Domm and myself. We would love to engage with you, have a conversation about hormones. This content is just the tip of the iceberg for what we do. If you have ever thought about hormone replacement therapy, if you have ever considered testosterone as an option, if you have been facing erectile dysfunction, becoming tired in the afternoon, all of those things that people will tell you it's just a matter of getting older. I want to tell you there is a way to see your life to the end and live the best life ever. I like to say many men die before they die, and what we're doing is we have the vehicle that will put the gas back into your tank to give you your best life.
Yeah.
Armur Medical,
Armur Medical. Armur Medical. And the one thing on that too is I have talked with literally thousands of men, and what I hear over and over and over again is, I wish I would have done this sooner. I didn't know that I got so old so young. And with the patients that we treat, we listen to them, we find out what's important to them. And here's another thing. I've got a lot of patients that have been on the gray market or the black market testosterones that are out there. And they come to me and they're a little bit shy about telling me what they've been on. I really don't care. It doesn't matter to me what you've been on in the past because I'm here to help you for the future. And a lot of people are a little apprehensive. Oh, you're going to think down on me or whatever. No, what I'm trying to do is get you so that we can get you living longer and stronger. A lot of the stuff you buy online will actually cause your cholesterol levels and your lipid levels to go crazy. And I've seen numbers into the 300s, triglycerides into the 600s. I had one guy, his triglycerides were 7,000, which are just crazy. And so people may feel a little bit better, but their physiology tells you a different story. And so I've had doctors that I've treated who have been, their wives, when talking with their wives, they say, my husband perseverates over everything. And when he's taking his testosterone, he doesn't care. The perseveration and the dwelling on things, it ceases, it stops. And so if you're ready to start living your life at its fullest, come on in, call Armur Medical. We can help you. We can talk to you about not only just testosterone, but balancing your hormones at an affordable price.
Armur Medical, we have low barriers to entry. You can give us a call today, set up a consultation. I'll meet with you one-on-one. I'll discuss what your goals are. what topics you want to bring to the table. I will show you the pathway to a new you, a better you for 2026. Love to chat with you. Give us a call today.